Dan Williams, Thrive Outdoors, where if you're new to the channel, we do wilderness medicine videos on all kinds of stuff, keeping you safe in the outdoors, getting you back safely. We talk about bugs and ticks and spiders and injuries, do a few gear reviews. We're going to talk today, as promised, about Chagas disease. Is it in the United States, and what in the world is it? Well, it is a parasite that is an egg is pooped from this bug, the kissing bug, when it bites you. And it was a tropical, it still is, it was and is a tropical disease in South America, Central America, Mexico for decades. And what it's done is, as with global warming, the armadillos have moved north, and the brown reclusives, they basically have moved a little farther north, and I think there's about 300,000 cases of Chagas in Arizona, Texas, Southern California. Now, that doesn't mean all those cases, those individuals were bit in the U.S. Some of those are people traveling and so on and so forth. But it has been found in some of the southern states. It gets confused all the time with this bug, which is the box elder bug, and looks really similar to this bug, the western conifer seed bug. Looks real similar, but you can see on the thorax, it has a wider flare on the thorax with a more bright orange. So that is the culprit. So if you go camping in Santa Fe or Albuquerque or down in Texas, and you're in your tent and you fall asleep and someone wasn't proficient at zipping the tent back up, this bug could be in there. And what it does, it bites you in while you're sleeping. It could bite you next to your eye, it can bite next to your lip, or next to a wound. The bite does not do anything, except it may itch a little bit. You could have a histamine reaction. When it bites, it poops. When it poops, it has an egg in its feces because it was infected previously. And then when you rub it, you get that egg into your eye, into your mouth, wherever, and you have Chagas disease. Trypanosomiasis is why, and the bug is Trypanosomiasis cruzi, C-R-U-Z-I. All right, so that's the bug, and that's how that whole pathophysiology works, where it bites you, and that's what can happen. You can use permethrin. It has been shown even DEET can help prevent that from happening because it finds you in the middle of the night, obviously with the carbon dioxide. So there's an acute phase of symptoms and there's a chronic phase of symptoms. The incubation period from the time you're bitten to the time you show symptoms is about 2 weeks on average. So you got someone vacationing and they fly back to New York City, Maine, Northern Illinois, Oregon, wherever, and they present with some of these symptoms, that should raise a red flag. Fever, rash, stomach pain. Ramona's sign is the upper lid will swell close to the bite site, only on one side of the face. Diarrhea, liver can be enlarged, spleen can be enlarged. Chronic cases, it's a little different. You can have this for 10 to 20 years. Cause congestive heart failure. You get peripheral edema. You get arrhythmias. So you can have all these other issues, and it's very difficult, obviously. I mean, how many people have congestive heart failure? A ton. So how do you assess that? Well, there is testing you can do. IFA is immunofluorescent antibody testing, and you can do that to confirm it. But your index of suspicion and the history has to be high to do that test. So, you have to ask the smart questions. Have they lived where they've lived all their life? Do they camp? Do they go to South America? Have they been in New Mexico or Southern California for any extended period of time? And at what time of the year were they down there? So these are all important questions to ferret out what could be going on. So this is a parasite. It's treatable. The meds that are used for this are anti-parasitic meds, obviously. Well, the brand name for one is called Lampit, Lampit, which is nitrophonics. There's another one that is benzodiazepine. Now, here's the difference. I've used albendazole a bunch of times for things like pinworms and different parasites. I did a video last year on cutaneous larva migrans. You can get that from raccoon poop, walking barefoot in the yard. And the treatment a lot of times is 7 days. Pinworms is like a few days. It's not a big deal. With this guy, with Chagas, you got to give these meds for 60 to 90 days. Now, the medication can affect the liver. I personally want to draw, very similar to doing an antifungal, I'm drawing a CBC and a CMP at 30, at 60, and 90 days to make sure there's no liver enzymes and make sure that the red blood cells are fine, because it can cause, I think in 2% of patients that were treated with this over 60 days, it can cause an anemia. So a little more info than you needed to know. But I just wanted you to be aware, because I think in the next 10 years that this is going to start increasing more and more and more. With the climate change and everything warming up, you're going to see more of this little critter. Make sure you identify it correctly before you panic. All right, guys, keep your eyes on the horizon, your face to the wind. Stay safe. If you like this, you want more of it, give me a thumbs up, subscribe. See you soon.